Okay, thank you, Pekka. And thank you for the previous presentation. Really thrilled to be here because now that I heard the previous presentations, I see that I'm gonna present a new topic, which is the business side of this healthcare. Even though I have the mission to give the power to the customers, I still have one goal because my employer is private business, private company, and my goal is to build revenue, of course. And how I see it, it's I have to listen to the customers because when I take care of our customers and make it easier for them everyday life and the health issues, we're gonna get customer loyalty, which is gonna build the revenue for us. And that's kind of the side where I'm looking into this subject. Little introduction to Mehiläinen. We are over 100 years old, private healthcare company. And why did I want to show this is that I feel that I have the greatest test lab for digital health services because we have over 1 million individual customers, over 2 million visits per year. We have almost 10,000 corporate customers. And this is kind of the playground where I get to test and do and design services. And the main thing for me is to listen to the customers. We have 6,000 customers on a platform where we can discuss about topics and we can get feedback from the customers even before we even design anything. We just give them topics, we ask, and luckily we get lots of answers. Well, this is pretty obvious. Digital health market is steaming hot right now. There's lots of startups, a lot of bigger companies raising funding, and I'm gonna get back to that. Why Mehiläinen is among those companies there, but still we are a private business and we want to generate new revenues and it's not a off the line kind of that we might be among those companies. And the key questions for us in digital health is how can we improve our processes, how we can improve the services, of course, how to enable better health and wellness for our customers. We want to use the high-end technologies, smartphone apps, remote diagnostics, monitoring, and etc. And then at the end, again, there is the higher customer loyalty and revenue growth. But this is the interesting part. What we have done, this is the case of our Oma Mehiläinen application, which is kind of in the center of our integrated care model. You can do the normal stuff, book appointment, you have the health records over there. It's pretty new. You get to see your x-rays, MRI pictures through the application. We have a digital clinic 24/7. And totally new in this market, we have a digital pharmacy, which is pretty cool because we are not even allowed to sell drugs or medicines. But still, this is pretty good example for how to collaborate with other companies, because this wouldn't be even possible if we couldn't find a company who made this possible, that we can kind of visualize the whole online purchasing process in our app, but we're not anyway selling the drugs or the medicines. So we're on the clear side, but still the customer wins in this case. Other things are, when we talk about the business side, is that we have different funders for the services. For example, insurance companies. And that's one of the main focus areas right now where we're trying to integrate. Because if you use, for example, digital clinic and you have at this moment, if insurance, we have a straight integration with their system, and if you tell us that you have if insurance, the system kind of checks if you have some kind of well, it gives us how much we have to charge from the customer and how much the insurance company will pay. So you don't have to make the claims and all that kind of things. The systems work together and solves that. And for this moment, at the first time, we really have a process which allowed our customer to get all the services in this kind of example to the home. So if you have some kind of symptoms, red eye in this example, you can take your app, take picture and direct messaging with the doctor over there. Just 10-20 minutes after the discussion. In this case, the doctor could make a diagnosis with the eye infection. All the information will be found in the application. The doctor writes a prescription, and still, if you are home or at your cottage or wherever, but in Helsinki metropolitan area, you can also order the prescription medicine to your home. So if you start the process at 8 a.m., it could be possible that 11:20 a.m. you already have the medicine at your home and you can start the medication. The other thing is that here is our registered users. We launched this application last July. It's pretty linear how the registers are coming, but which is interesting is that the digital clinic usage is kind of, it's not exponentially really, but it's kind of taking the curve to look like that. So the analysis is, what I made is that it's getting familiar every day, and people are starting to trust to the remote services and the digital health services in general. So I guess that's the one reason. And the other reason is that we get super good feedback all the time. Even in the social media, this is probably my favorite one. In Sunday, 3 p.m., in 7 minutes, you get your prescription renewed, and you can go to the pharmacy and get the medicine. And I think this is the most rewarding when we can kind of like make the wow effect on our customers, that it could be this easy. And next steps, of course, all of these subjects has been in previous presentation, but artificial intelligence, big data analytics, integration of wellness data and services, which will be kind of supporting the digital clinic idea. We get, like Matti said in his presentation, that there could be like artificial intelligence and the wellness data, and we can kind of direct our customers to the right services in the beginning, even without never getting any human kind of consultation between. Remote diagnostics and service portfolio, that's made really big focus for us. And also the international rollout is possible for us. But these are the kind of topics we are battling right now. And the big question for me is, what do you think is the next big thing in practice? Maybe it's not the 3D printing, I don't know what we could do with it, but what is the next big thing to kind of like make the wow effect on our customers? Thank you.